As chemotherapy has improved over the past 5 or 10 years, one of the most important improvements has been in the control of nausea and vomiting. We now have very good medicines such as intravenous Amend or intravenous Aloxi that for the vast majority of patients control the nausea and vomiting very, very well. In many breast cancer patients, given this type of aggressive anti-nausea management, vomiting may never occur and they may have minimal or no nausea. So that in the past 10 years, nausea and vomiting, certainly in my practice, has become much less of an issue. Unfortunately, there are still a few people, certainly less than 5% of patients, that no matter what we do, they seem to have persistent vomiting. One can change the anti-nausea medicines, or if that doesn't work, one is ultimately pushed to do a different chemotherapy that we would hope would be as effective, but use drugs that are less common to cause nausea and vomiting. One of the regimens that we've gone to sometimes is a regimen of weekly Taxol for patients who have a lot of vomiting, and that's a regimen that's very well tolerated. But the first thing I would suggest is to be more aggressive in the choice of intravenous and oral anti-nausea medications. The other issue of diarrhea is not a real common issue with chemotherapy, but it can be an issue with a class of drugs known as taxanes, such as Taxotere and Taxol. They can actually rarely cause some severe abdominal problems, and this has to be watched for very carefully. The other issue is that if a patient has persistent diarrhea, one starts to look for other causes of that diarrhea, and one of the issues would be to do a stool culture for an organism called C. difficile that can cause persistent and uncontrollable diarrhea that can result in dehydration and sometimes hospitalization. For the most part, most patients do not have any major vomiting or major diarrhea, but when these do occur, in general, we have things to do that will control them.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.